This is one of the most common questions I get in my clinic. Can I still do Botox or filler if I'm trying to get pregnant? And the answer is not just a yes or no, it's about understanding timing, safety, and medical responsibility. So let's break it down in a way that actually makes sense. First, let's define the phases because this matters. There are two very different situations. You are trying to get pregnant or you are pregnant. And medically, we treat these very differently. Let's start with pregnancy. If you are pregnant, or you think you might be pregnant, we do not perform aesthetic treatments like Botox, dermal fillers. And the reason is not because we know they're harmful, it's because there is no strong clinical data providing that they are safe during pregnancy. So in medicine, we always take the safest route, which is to avoid elective treatments during pregnancy. Now let's talk about trying to get pregnant. This is where it gets a little more nuanced. If you are actively trying but you are not pregnant at the time of treatment, many providers will still treat patients, but with caution and proper counseling. Here's how I explain it to my patients. If you are early in your cycle, you've had a negative pregnancy test, and you're working closely with your provider, you may choose to proceed with treatment. But here's the key. This is about informed decision making. There are a few important things to understand. There is no evidence showing harm, but also no studies proving safety. Timing matters. You want to avoid treatments if there is any chance you could already be pregnant. This should always be discussed with your provider so you can make the best decision for you. Let's talk specifically about Botox. Botox works locally in the muscle and has minimal systemic absorption. Because of that, some providers feel comfortable treating patients who are trying to conceive as long as they are not pregnant. But again, this is not something we do once pregnancy is confirmed. And what about filler? Dermal fillers like hyaluronic acid fillers are also not recommended during pregnancy. When it comes to trying to conceive, the same concept applies. It's less about proven risk and more about lack of safety data. So this becomes a personal and clinical decision made with you and your provider. I always tell my patients this: if you're trying to get pregnant, be intentional with your timing. If you know you're not pregnant in that moment and you want to do your treatments, this can be your window to refresh your Botox, do any filler you've been thinking about, so that you can go into pregnancy feeling confident and low maintenance. But once you are pregnant, we pause. At that point, we shift focus to skincare, facials, internal wellness, and supporting your body in a safe and healthy way. And I want to end with this. This is not about fear. It's about being informed, intentional, and supported. You deserve to feel beautiful and confident, but also safe and protected, especially during such an important time in your life. If you're trying to conceive or you're not sure what's safe or when to time your treatments, I always recommend having a personalized consultation because every journey is different, and my goal is to guide you in any way that feels right for you.